Hi classmates, hi professor, this is Victoria Vasco. I am working on my week 4 presentation of the case prior to my SOAP note. I'm currently been doing OBGYNs, so I apologize. This is going to be another case study of an OB patient. For HIPAA purposes, I'm going to keep calling my patient Emily. This time she was a 24-year-old female. Her chief complaint coming into the clinic was nausea and vomiting. Intermittent vomiting, but having a lot of diarrhea, and she is 11 weeks pregnant and has not had any prenatal care up till now. As far as her past medical history goes, she is gravida 2, para 0. She admits to having an elective abortion 2 years ago. This current pregnancy was planned. She's married, lives in an apartment with her husband, and seems equipped to be having a child, and has made preparations. Her last menstrual period was July 1st. She has regular menstruation with a 28-day cycle. She is doing well at this time, doesn't have any complaints aside from the constant nausea. She has occasional diarrhea, which she associates with her previous diagnosis of irritable bowel syndrome, but she admits that she seems like it's gotten worse since she's been pregnant. So that's something we're going to need to monitor. She denies any fever, any chills, any vag bleeding, any blood in her stools. No other real concerns seem pertinent at this time. Her last pap smear was the first of the year, and it was normal, and she's had annual pap smears since she became sexually active at 18, and they have all been negative. She has tested repeatedly negative for any kind of STDs. She denies any exposure to Zika. She denies any recent travel. And her last dental exam was at the first of the year as well in January of 2020, and that all revealed to be perfectly fine. She does not have any allergies. Currently, she is only taking prenatal vitamins. She does not have any previous medical history. She states that the only medical history that's in her family is her sister who struggles with asthma. As far as her social history goes, she's full-time employed. She's a medical assistant. She's insured. She does not smoke. Currently, she admits to smoking when she was in her very early teens, but has not smoked since she was 20. Used to drink 1 to 2 alcoholic beverages a week until she found out she was pregnant, and has not drinking since, and she does not take any illicit drugs and does not have a history of taking them before. She admits to drinking caffeine, but has not drinking any caffeine since she had found out that she was pregnant. She is slightly overweight, weighing in at 164 at this time, at 5 foot 5 inches, and she admits that she does not exercise regularly, but feels the need that she needs to start doing some at least low impact exercise while she's pregnant. As far as the secondary assessment goes, she is awake and alert with no neurological findings, no skin rashes. She denies any vision changes, sore throat, runny nose. She denies any thyroid issues. Complains of generalized tenderness to her breasts at this time, but denies any kind of discharge. Her nipples appeared normal and extroverted. She denies any dysuria, hematuria, vaginal discharge, bleeding. Denies any extremity weakness, and like I said, no neurological findings were found. She is 5 foot 5, weighs 168 pounds. Her current blood pressure is 126/73. Her heart rate is 78. Her respiratory rate is 16, non-labored. And she, at this time, is afebrile with a temp of 98.7. As far as the general assessment went, her lung sounds were clear. There was no evidence of any kind of murmurs or palpitations, no chest pain, no complaints of shortness of breath. I mentioned before there was no abdominal pain, no vag bleeding, no dysuria or anything that we need to worry about at this point. So this assessment and this encounter turns out to be a supervision of a normal first pregnancy, and she is having nausea during her first trimester of pregnancy. And she has an underlying history of irritable bowel syndrome, and she's having some diarrhea associated with that. The plan at this time is to perform the first trimester prenatal ultrasound. We're going to do a UA, a GC chlamydia, a type RH antibody, a VDRL, rubella, random glucose, sickle cell, Hep B, C, the HIV, and we're going to schedule the patient for a 1-hour glucose tolerance test at 24 weeks. I'm also going to educate this patient to help her with her nausea, to eat before she's feeling hungry, have snacks between meals, eat slowly with small amounts. She's going to avoid coffee and dairy products, soda, anything spicy, high-fat foods, or any kind of acidic foods. She's going to drink lemon or mint or ginger tea, and I plan on starting her on paroxetine, 10 milligrams, Q 6 to 8 hours to help her with her nausea and vomiting during pregnancy. The big thing is to remind her to remain hydrated during this period of time of her pregnancy. As far as addressing her irritable bowel syndrome, she can take Imodium for her diarrhea. Her current estimated date of delivery is going to be April 7th, 2021. So at this time, it's reasonable to have the patient start thinking about a birthing plan, and also to educate the patient about the stages of pregnancy and about what she's going to feel and to expect. I want her to know that the normal weight gain is 25 to 35 pounds. And I also want her to start on low impact routine exercises such as walking. I also want her to know that her nausea should subside by the second trimester. And I'm going to have her follow up in the clinic for routine prenatal care. At this point, I think this concludes this case study. I will follow this up with my SOAP note. Thank you.